Hello, my name is Jane Stiles. I'm an emergency department nurse and the Emergency Medical Services Coordinator for Jordan Hospital. I am here to talk about stroke. Stroke is the leading cause of death in the United States and can cause long-term disability. A stroke occurs when the supply of blood and oxygen to the brain is blocked. The brain's nerve cells die without blood and oxygen, and part of the body they control will not function. There are several types of stroke. Ischemic stroke is when blood vessels become blocked or clogged by fatty deposits known as plaque, cutting off blood flow. About 87% of strokes are ischemic strokes. A hemorrhagic stroke is when a blood vessel ruptures in or near the brain. About 13% of strokes are hemorrhagic. With hemorrhagic strokes, patients may be younger and complain of a headache and have nausea and vomiting. It's important to recognize the signs and symptoms of a stroke so that you can receive early intervention and increase your chances of survival. The signs and symptoms are sudden weakness or numbness of the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness and loss of balance and coordination, sudden severe headache with no known cause. There are several risk factors for stroke. Some you cannot control, but there are several that you can. Here are the general risk factors for stroke. Smoking that can damage blood vessels. High blood pressure is the leading cause of strokes. Diabetes, a blockage in your carotid artery. A cardiac condition known as atrial fibrillation, which can cause the blood to pool and clot. Certain blood conditions, such as sickle cell anemia, which makes the blood clot more easily. There are risk factors, such as age, gender, hereditary or race, or past history of a stroke that may be out of our control, but there are many factors that we can control, like having your blood cholesterol level checked because high levels increase the risk of clogged arteries. Your blood pressure, for example, can be controlled with medication. Managing your diabetes. Jordan Hospital offers a comprehensive program to help you manage your diabetes and keep symptoms under control. Watch your weight and increase your physical activity. Reduce your alcohol intake and do not use illegal drugs. If you smoke, there are many programs to help you stop. Jordan Hospital offers such programs to the public. If you suspect that you or someone you are with is having a stroke, here's what you should do. Act fast. Call 911 immediately. Note the time of the onset of symptoms. A clot buster medication known as TPA, tissue plasminogen activator, is an FDA-approved medication used for the treatment of stroke within 3 hours of the onset of symptoms and can help reduce long-term disability. It's important to be evaluated as soon as possible so this drug, if appropriate, can be administered. What can you expect in the Jordan Hospital Emergency Department if you suspect you have had or are having a stroke? Well, a doctor and a nurse from our emergency department perform a rapid assessment. A CAT scan of the brain is done quickly to determine what type of stroke it is. An IV will be started and blood work is sent to the lab. After the CAT scan is completed, a neurology exam is conducted at the bedside by a neurologist or with a program called telemedicine with neurological staff from Mass General Hospital. The neurologist views the patient on screen in real time to determine the symptoms of stroke. The neurologist reviews all the test results to determine if TPA is indicated for the patient. Sometimes TPA is not indicated. The patient is admitted to Jordan or transferred, depending on their type of stroke or other presenting factors. Jordan Hospital's emergency department has received high marks from the State Department of Public Health for our stroke protocol and our ability to care for you and your family in case of a stroke. So remember, when it comes to stroke, reduce your risks, recognize the symptoms, and act fast to increase your chances of surviving a stroke. Thank you.